Thank you so much for the kind invitation to join you all for this wonderful symposium today. Thanks, Dr. Appleby and Dr. Fernandez. I'm thrilled to be invited about my favorite topic today, which is lifestyle medicine for brain health, the prescription we all need. And I hope to make this a practical talk for you where you're all gonna take away some ideas of what changes you might make in your own life. So just to give a quick overview of what they'll be covering, we'll touch a little bit on the rise of Parkinson's disease, and then mostly focus on what lifestyle medicine can offer to optimize our health and brain function. And as I said, we want to mostly hope that you will take some practical advice away from this talk, but you can implement starting today. You have probably heard that Parkinson's disease has become more prevalent, and not only in the US, but really around the world. So here's some numbers about the projected global burden of Parkinson's disease. And many of these are driven by increased age in the population. So in 1990, there were an estimated 2.6 million of people living with Parkinson's disease around the world. In 2015, this actually tripled to 6.3 million. And in 2040, we will have an expected 17.5 million of people with Parkinson's around the world. And very similar kind of increased trends are also seen for Alzheimer's disease. So you will hear lots of things around Parkinson's research later in the day, and other advancements, including surgical advancement of treating Parkinson's disease. But we will here take a bit of a step back and look at practical measures that you can do yourself in your life starting today that might make a huge difference for your Parkinson's disease and overall quality of life. So how is lifestyle medicine defined? The official definition is the use of evidence-based lifestyle therapeutic approaches, such as a predominantly whole food, plant-based diet, regular physical activity, adequate sleep, stress management, avoidance of risky substance use, and other non-drug modalities to treat, oftentimes reverse and prevent the lifestyle-related chronic disease that's all too prevalent. And if you're interested to hear more about the definition, I have kind of included the link to the official website here. So the foundation for lifestyle medicine is certainly nothing new. And these are overall principles that have really been with humanity for a very long time. So to quote Hippocrates, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. And what distinguishes lifestyle medicine from traditional medicine? So, when we used to think, well, we go to the doctor, we want to be fixed, we want a cure for what we're suffering. Many times doctors would focus on our individual risk factors, maybe prescribe a medication, but oftentimes not necessarily engage in a big dialogue on our preferences. And so in the traditional medicine model, patients were often the passive recipients of care. The doctor was the one providing solutions. Now, these things are definitely changing in medicine overall, and sort of a shared decision-making model is really what most doctors are striving for these days. But in lifestyle medicine, the focus is really on that. The focus is the whole patient, and really looking at our health holistically, looking not only at medications as a solution for the problem, but a large aspect is really these lifestyle habits, so to speak. And patients are seen as very active partners in their care, and long-term significant changes in the lifestyle habits are actually expected to help promote healthy changes. So to make this a little bit more tangible, but what does this mean? I'm going to present a story of one of my former patients with Parkinson's disease, which I hope will inspire you. Here is Walter. There's a picture of Walter taken in 2018. He was diagnosed with Parkinson's disease in 2010, initially presenting with right-hand tremor. He had a good response to dopaminergic medication, but over the years developed more off time, meaning he was noticing bearing off effect from the medication. We switched him from the carbidopa-levodopa immediate release to Rytary, which is a medication with a longer release, which provided him benefit. However, on many visits, he was complaining of fatigue, low mood, and problems with his sleep. He had a very high-stress job and ultimately decided to retire in 2019. He was also diagnosed around that time with gastroparesis, which is not uncommon in Parkinson's disease and means that the gut slows down and can't digest food as well. And diet changes were recommended. Now, we had discussed in many visits that changes in diet and exercise would be highly recommended to improve exactly these so-called non-motor issues, to help with his fatigue, to help with his sleep. Now, Walter was really showing some remarkable motivation around this time of retirement, and was really deciding, let's really try this out. Let's really give this my best effort and see what I can achieve by actually dedicating my full energy towards making these shifts. And that's what he did. So here's Walter now in 2022. So this was just a photo he sent me last month, about to take a walk. So he's in his exercise gear. And Walter really made a remarkable transformation in his life. He changed his diet. He mostly just started to control his portions more, avoided high fat and high sugar foods, and then exercised on an essentially daily basis. He started initially with physical therapy, balance training, and then worked himself up to daily walks up to 2 hours. In this process, he lost 72 pounds, but mostly his quality of life is just dramatically improved. He's feeling more energetic and less tired, and his mood is improved as well. So again, these changes have not been achieved with a change in his Parkinson's medication, but mostly diet and exercise. So let's talk a little bit more, dive a little bit more in the pillars of lifestyle medicine. And as I mentioned, the healthful eating diet and focusing on predominantly whole food, plant-based diet. We'll talk a little bit more about what that means. Physical activity, but also managing stress well, getting good sleep, our social relationships, and avoiding risky substances. All these things ultimately come together. And today we're focusing mostly on the diet, the exercise, and the social connection pieces of the lifestyle medicine pillars. So what is the healthiest diet? What should we eat? And it can be confusing because there's so much advice out there, so much contradictory advice, right? But ultimately, I think what a lot of healthy diets boil down to is what the famous author Michael Pollan has so nice summarized here in this quote: eat food, not too much, and mostly plants. And why should we do that? Why the big focus on plant-based eating? So we have known for a long time that plant-based diets may reduce the risk of coronary heart disease by 40%, by cerebral vascular events, by strokes, by 30%, and developing metabolic syndrome and type 2 diabetes by about 50%. So these are staggering numbers. And then the same, we're learning more and more, also applies to developing neurodegenerative diseases such as Parkinson's and Alzheimer's disease. So another kind of way of looking at it, what is the healthiest diet? is looking at what can be learned from areas of the world where people live the longest. And you might be already familiar with this concept of the so-called blue zones. Now, blue zones are areas in the world where there's the most people living over the age of 100, and not only living to old age, but being very active in their 80s and 90s. And those are some of these areas that are in Okinawa, Japan, in some islands in Italy and Greece, an area in Costa Rica, and also Loma Linda, which is a area with a high percentage of Seventh Adventists in California. And what these areas have in common, and there's lots and lots written and published about this, is a predominantly whole food diet with vegetables, really a high intake in vegetables and fruits. People move naturally, have a high social connection level, and like I said, eat wisely. And so again, I can kind of just touch on this here, but this is part of why this focus on a high intake in plants really comes from. Now, how does this contrast to our usual eating pattern here in the U.S.? So here's what often an American diet looks like, right? We often eat this highly processed food, whether that's donuts or pastries, whether that's our fast food, junk food, and so on. And contrasting that with, well, what would a whole food plant-based pattern actually look like? And so we can see that we really try to fill the plate with lots of fresh vegetables and fruit, whole grains, and that can be rice and lots of natural grains, but not highly processed grains ideally, and plant-based proteins. Now, I can already hear lots of people in the audience thinking, well, I don't want to be a vegetarian or vegan, and that's okay. We never need to be 100%. Actually, making just even small changes can already produce great health benefits. Now, what about dairy? And we're all kind of made to believe that milk is sort of a necessary part of our diet. But it turns out that milk has been linked to a greater risk of Parkinson's disease in several studies now. And the connection is partly driven by pesticides in the milk. So you could probably get partly around it by consuming organic milk. But again, there's more and more studies that, especially for adults, the dairy is not an essential necessary part of our diets, and we can actually get our calcium demands from many other nutrients in our food. So again, just some thoughts here to think about some more. So as I mentioned, we have learned more and more that this diet, very rich in vegetables, is actually really important for brain health. And here's a nice study done at Rush in Chicago that looked at the so-called MIND diet associated with Alzheimer's disease. And they included 1,000 patients between the age of 58 and 98. And found that a strict adherence to the MIND diet, which is based in predominantly plant-based diet, limiting meat and dairy, resulted in a 53% reduction in risk for Alzheimer's disease. So those are some really staggering numbers. And if you had a pill with a similar benefit, it would be all over the news and all over TV advertisement, right? But because there's little to sell on this kind of eating pattern, right? There's not a company to really kind of sell a product. These findings have often gotten less attention than they probably deserve. There was another recent publication I wanted to mention. This is hot off the press just from last month, but showed that ultra-processed food consumption had a significant increase for the risk of dementia. And this was a study that looked at the so-called UK brain bank, so United Kingdom, at a high number of people, and that were enrolled at an average age of 55, and then followed them for at least 10 years and compared their diet pattern with the risk of getting dementia. And what they found is that eating ultra-processed food, and those are essentially all the foods that have the ingredient list that is pretty long, and you don't really understand most of the things that are in the food because they have a lot of food additives, stabilizers, and so on. Eating that diet pattern, that is actually the predominant diet pattern for so many of us, there was at least a 10% increase for Alzheimer's disease. But excitingly, what they also found is replacing just 10% of this diet pattern with unprocessed or minimally processed food. So that's sort of the food with one ingredient, right? You just buy your vegetables from the farmer's market or supermarket, but there's no additives to it. So replacing your food with unprocessed food was associated with a almost 20% lower risk in dementia. So it comes back to, you don't need to be all or nothing, right? There's no all or nothing thinking. Making even small changes can still have significant benefits for your brain health. And here's just sort of a top 10 best foods for your brain, best foods for your brain. So leafy greens, whole grains, seeds, beans, berries, nuts, cruciferous food like broccoli, teas, mushrooms, herbs, and spices make sort of the top of the list here. The bottom is pastries and sweets, highly processed foods, meats, butter, fried foods, cheese, sugary drinks, and excessive alcohol. And how can this look like in practice? And this is from my food journal. So this is how I usually start my day with a smoothie. I put in a lot of spinach, some almond milk as a liquid. You can add some fruit, berries, nuts, flaxseed. So lots of things you can add there to start your day healthy, and either some protein powder or possibly some unprocessed yogurt for protein. There's lots of healthy, delicious options to eat lunch and dinner with salads, with grain bowls, with stir fries, vegetables. And if you're interested in some more inspiration, I've collected a couple helpful websites here, nutritionfacts.org, thebigswish.com. So really showing you how to make a switch from a meat-based to a vegetable-based diet. And it's not a typo here. And then Forks Over Knives is also a wonderful website. Another practical resource, so Dr. Michael Greger is a physician advocating this type of eating pattern. He has written a wonderful book called How Not to Die. And there's a free app called The Daily Dozen where you can track, are you getting the good nutrients, and really kind of shifting your mindset from, not focusing on, well, what can you not eat, but focusing on what you can eat to feel better. So lots of resources available, and I'm encouraging you to check these things out. So let's shift gears a little bit and talk about exercise. As we all know, exercise has many benefits for our body and the mind. And it's, of course, important for our heart health, our digestive health, actually our immune system. But then what we're talking about here is our brain health. And there's many studies I could present to you. And in the interest of time, I'm just focusing on this one study here that was recently presented at an international Alzheimer's conference this summer. And this was actually the largest study looking prospectively at the benefit of exercise on cognitive decline, meaning on our memory function. And what was done in this study is that almost 300 sedentary men and women, so people who did not exercise on a regular basis, with mild cognitive impairment were included. They were assigned to either an aerobic exercise group, meaning they were doing cardiovascular exercise of at least moderate intensity, or balance and stretching exercises, which was low intensity. And they were supervised in the initial 6 months to exercise 4 times a week for 30 to 40 minutes. And then the exciting finding of this study was not only did people in the study maintain their memory function over a 12-month period, but the benefit was seen in both groups. So whether they did the moderate intensity aerobic exercise or the low intensity exercise, they maintained their cognitive function. So the take-home message here, you don't need to think, oh gosh, I can't exercise because my knees are bad. I can't exercise because it's just too strenuous for me. Even starting slow and doing things like stretching and balance exercises can have significant benefits. So this ties in very well with the general guidelines for Americans for exercise, which advocates 150 minutes per week of moderate intensity of physical activity or 75 minutes of vigorous physical activity. So if you're one of these people who currently do not exercise, try to find your motivation, right? Try to imagine how your life could be different if you would exercise on a regular basis. And that could be all kinds of things, right? Seeing other people with struggling health, wanting to play, be more active, to be able to play with your grandchildren. Lots of things can be motivators. And then it's important to look at your obstacles. Why are you not exercising already, right? And, like our example with Walter, if you're having a very high stress job, you might not find the time or might not make the time. So looking kind of at your obstacles to try to plan, well, how can you make changes to prevent those? And coming up with strategies, well, how could you plan to overcome your obstacles? Identifying your motivator, trying to find an exercise partner, whether that's your spouse or a friend, can be a very helpful strategy. And really thinking, well, what time of the day could you use to actually make it happen? And what's a very helpful strategy is to actually write down a goal. You might have heard of SMART goals before. So what a SMART goal is it's a specific, it's measurable, it's action-oriented, but it's also realistic and time-sensitive. To give you some examples, so here's a couple of goals that people might have. For example, I will lose 10 pounds. I will eat less processed food and more vegetables. Well, those are not SMART goals. And as a wise man has said, a goal without a plan is just a wish. So rather than making these very vague goals for yourself, try to be specific. So here's a SMART goal. This week, I will exercise 3 times for 20 minutes each, and actually writing down in your calendar when and what that will be. That's going to be much, much more likely that you'll actually follow through in this. Okay, we're going to shift here to the last part of the talk, and this is centered around the power of social connections. And again, that was one of the factors that people living in these blue zones, the areas of longevity, had also in common. We know that social isolation is a predictor of mortality comparable to traditional risk factors like smoking. Listen to this again. Social isolation has a similar bad effect on your longevity compared to smoking. So that's quite remarkable. And again, that's usually not something we hear about a lot. Social isolation is smoking as well as high blood pressure. So again, that's not something that doctors usually ask about, but it is very important for your health. Now, what is the opposite of connection? So disconnection, separation, isolation. Unfortunately, these things were just all too common for most of us, for so many of us during the past years due to the pandemic. And here's two colleagues of me from the West Coast, Dr. Submarian in LA and Dr. Nishley up in Portland, Oregon. And they studied the effects that social isolation had on people living with Parkinson's disease, and unfortunately found that social isolation was very much associated with reduced quality of life. So what can we do? What can we do to stay connected, to be more connected? And here's just some ideas. Reaching out to your family and friends on a regular basis, even if you don't feel like it, really try to making that a routine. We can volunteer in our community. We can also engage in online communities or groups of people with similar interests. We can join a religious or spiritual group, helping at animal shelters, attending sports events. So there's no limits really to your creativity. And shifting over a little bit from the social connection to also stress reduction. Couple more tips to this living wisely. Again, think about these blue zones. What do people in very tight-knit communities? And so we can adopt an attitude of gratitude and really kind of reflect. Yes, our lives are difficult, right? We were just going through this COVID pandemic. You might have Parkinson's disease or another chronic illness that throws a lot of obstacles in your way. But focusing on the things that we are grateful for, that do enrich our life, can make a huge difference. Acting towards others from an altruistic rather than self-centered motive. Retaining our capacity for wonder and delight, and those can really be in little things. We can have little joys in our lives every day. Finding a purpose for our life and expressing our individuality to fulfill that purpose. So these might sound like some lofty goals, but taking some time for reflection can help us to see kind of our bigger picture and make some changes that help us to feel more connected, feel more grateful, and ultimately feel more in control of our lives. So with that, I'm just going to remind you again, we talked today mostly about healthful eating, about physical activity, stress management, and social connections. We didn't focus much on sleep and avoiding risky substances, which are also in the pillars of lifestyle medicine. But I hope that you are inspired. Think back of the story of Walter. There's always things you can do and you can change. And maybe take a minute right now to think about what changes you could make towards better health. Thank you very much for listening, and I will be available later in the afternoon for questions.